Alright, so today we're going to go over Chapter 43, Sleep for Fundamentals, see what we know about it. So, the most familiar rhythm in the 24-hour day-night cycle is our circadian rhythm. We know that. It's 24 hours. So, there are some things that our body does that are dependent on the maintenance of the 24-hour circadian cycle. What do you think some of those things would be? Like our vital signs, hormone secretion, sensory acuity, and mood. And we know there are different things, like externally, that affect our life. And we know that people function differently throughout the day. Like some people can go to bed at 8 p.m., others go to bed at 2, and so do fine. And we know at hospitals, they do not adapt to their sleep cycle. They adapt to their cycle, the hospital cycle, all right? So tell me about body temperature, how it usually goes throughout the day. Peaks afternoon and gradually decreases and drops shortly after a person falls asleep. So what do you think the major sleep center in the body is? Hypothalamus. Okay, so what are the two phases of normal sleep? Non-rapid eye movement and rapid eye movement. So non-rapid eye movement, 90-minute cycle. And you go through 4 stages, 1 to 4, and you get increasingly deeper in sleep. Lighter sleep is usually 1 to 2, and deep sleep is 3 to 4. Deeper sleep is called like a slow wave sleep. And REM is at the end of each sleep cycle. So, tell me about stage 1 in REM. So it'll last like a few minutes. It's the lightest level of sleep. Your vital signs and metabolism fall gradually. You can be aroused easily, and you feel like you're daydreaming if you get woken up. Talk about stage 2 in REM. So it lasts 10 to 20 minutes. It's a period of sound sleep. Relaxation progresses, body functions continue to slow, and arousal remains relatively easy. Talk about stage 3 in REM. Stage 3 roughly lasts 15 to 30 minutes. It's the initial stage of deep sleep. Muscles are completely relaxed. Vital signs decline but remain regular. And sleep is difficult to arouse and rarely move. Talk about stage 4 in REM. This stage lasts approximately 15 to 30 minutes. It's the deepest stage of sleep. If sleep loss has occurred, you spend a longer portion of your time here. Vital signs are significantly lower during waking hours, and sleepwalking and enuresis sometimes occur here. It's very difficult to wake them up. Tell me about REM sleep. So stage usually begins about 90 minutes after sleep has begun. Duration increases with each sleep cycle and averages 20 minutes. You have vivid, full color dreaming occurs. Less vivid dreaming occurs in other stages. And it's stage is typified by rapid moving eyes, fluctuating heart and respiratory rates, increased or fluctuating blood pressure, loss of skeletal muscle tone, and increase of gastric secretions. It's very difficult to wake them. So how long does the pre-sleep period last? 10 to 30 minutes, but could be a lot longer. So when we sleep, we know our heart rate falls to 60 beats or less. It helps the cardiac function. NREM sleep continues to body tissue restoration, which is nice. And a loss of REM sleep leads to confusion and suspicion. And we know about the dreams in the REM sleep. So what does hypothyroidism do to sleep? It decreases stage 4 sleep. What does hyperthyroidism do to sleep? It takes people longer to fall asleep. And we know nocture, what is that? Having to urinate during the night makes it difficult to sleep, go back to bed. So we have this thing called Restless Leg Syndrome. What type of patients would that be most common in? Women, older adults, and those with iron deficiency anemia. Okay? So just to go back and summarize what we went over in these last couple minutes, circadian rhythms, 24 hours, and it helps us predict our body temperature, heart rate, blood pressure, hormone secretion, sensory acuity, and mood. There are different external factors that affect our sleep cycle. We function differently, but hospitals don't follow our sleep cycle. Temperature peaks in the afternoon, but gradually decreases overall. Hypothalamus is the major center in the body for sleep. You got non-rapid eye movement, which is the first stage, lasts 90 minutes, 4 stages. 1 to 2, lighter sleep. 2 to 4, 3 to 4, deeper sleep. It's called a slow wave sleep. And then you got rapid eye movement, which is right after. Stage 1 of the NREM, a few minutes, lightest level of sleep. Decreased function, you can wake them easily and you feel like you're daydreaming if you get woken up. Stage 2, 10 to 20 minutes. Sound sleep, relaxation continues, body functions continue to slow, and you can still wake them up relatively easily. Stage 3, 15 to 30 minutes. It's the initial stages of deep sleep. Muscles are completely relaxed, vital signs decline but remain regular, and it's harder to wake up. Stage 4, 15 to 30, deepest stage of sleep. If sleep loss has occurred, you're going to spend a lot more time here. Now, vital signs are significantly lower. Sleepwalking and neurosis occur here, and it's very difficult to arouse. And then the Rem sleep, 90 minutes after sleep has begun, increases each cycle, averages 20 minutes. You got the vivid, full-colored dreaming occurs here. You got rapid moving eyes, fluctuating heart and respiratory rates, increased fluctuating blood pressure, loss of skeletal muscle tone, and increased gastric secretion. Very difficult to wake up. Hypothyroidism decreases stage 4 sleep, and hyperthyroidism causes people to sleep longer, take a long time to get to sleep. And then nocturia is having to use the restroom at night. And then restless leg syndrome, that's with people who are iron deficient, anemia, women, and older people. Okay. So we got some classification of sleep disorders. So insomnia would be like adjustment sleep disorder, like acute insomnia, inadequate sleep hygiene, behavioral insomnia of childhood, insomnia caused by medical condition. Then you got sleep-related breathing disorder, so like central sleep apneas, all those. Obstructive sleep apnea being the most common. Then you got hypersomnias, not caused by a sleep-related breathing disorder, so like narcolepsy. Menstrual-related hypersomnia and hypersomnia caused by medical condition. You got parasomnias, disorders of arousal, like sleepwalking, sleep terrors. Parasomnia is usually associated with REM sleep, like nightmare disorder and REM sleep behavior disorder. You got other parasomnias, so like sleep-related hallucination, sleep-related eating disorder, sleep-related neurosis and bedwetting. Circadian rhythm sleep disorders. Just read these. So, insomnia disorders are related to difficulty falling asleep, frequently awaking from sleep, short periods of sleep, or sleep that's not restorative. We'll get more into these in a little bit. So, what's the most common sleep-related complaint? Insomnia, and that is what? Basically, like difficulty falling asleep, waking up frequently, stuff like that. If you have insomnia, what is that usually signalizing? You have like an underlying physical or psychological disorder going on, and what type of person would have insomnia most commonly? Women. What else is also associated with insomnia? Poor sleep hygiene, stuff like that. All right, what is sleep apnea? It's characterized by lack of airflow through the nose and mouth for periods of 10 seconds or longer during sleep. What are the 3 types of sleep apnea? central, obstructive, and mixed apnea. What's the most common sleep apnea? Obstructive sleep apnea. And what are the two major risk factors for obstructive sleep apnea? Obesity and hypertension, but smoking, heart failure, type 2 diabetes, alcohol, and family history could also increase that problem as well. What is obstructive sleep apnea? So basically, the muscles or structures in the throat relax during sleep, and that causes the upper airway to become partially or completely blocked for potentially as long as 30 minutes. And the person still attempts to breathe because the chest and abdominal movement continue, which often leads in loud snoring and snorting sounds. When breathing is partially or completely diminished, each successive diaphragmatic movement becomes stronger until the obstruction is relieved, and this can lead to like a deviated septum, nasal polyps, certain jaw configurations, a larger neck circumference, or enlarged tonsil predispose a patient to OSA. And then we have excessive. What's the most common complaint of people with obstructive sleep apnea? Excessive daytime sleepiness. It's crazy. And then when you have OSA, your oxygen kind of decreases, and your risk for like cardiac dysrhythmias, right heart failure, pulmonary hypertension, angina attack, stroke, and hypertension. What is central sleep apnea? You got like a dysfunction in the respiratory control center of the brain. The impulse to breathe fails temporarily, and nasal airflow and chest wall movement ceases. Oxygen falls, and this is common in patients with brainstem injury, muscular dystrophy, and encephalitis. Usually they wake during sleep and complain of insomnia and excessive daytime sleepiness. It's kind of crazy. All right, reviewing, we have these classifications of sleep disorders. You can look at these if you like. Insomnia. It's basically you're having problems falling asleep, or you're waking up sleeping. It's like chronic, and the most related sleeping complaint is insomnia. This happens mostly in women. And poor sleep hygiene can be associated with insomnia. Sleep apnea is characterized by the lack of airflow through the nose and mouth for periods of 10 seconds or longer during sleep. You got central obstructive and mixed apnea, most common being obstructive sleep apnea. With obstructive sleep apnea, the major two risk factors are obesity and hypertension, but smoking, heart failure, type 2 diabetes, alcohol, and family history can increase the risk. The obstructive sleep apnea, the muscles kind of relax during sleep, so the upper airway becomes blocked. You can't breathe. You try to fix it, you start snorting and snoring loud. And until you fix that, and it could potentially cause a deviated septum, nasal polyps, certain jaw configurations, and a larger neck circumference, stuff like that. And the most common complaint of people with obstructive sleep apnea is excessive daytime sleepiness. You have a serious decline in oxygen levels with OSA, so you could get cardiac dysrhythmias, right heart failure, pulmonary hypertension, angina attack, stroke, hypertension. And then central sleep apnea, dysfunction respiratory control center of the brain, impulse to breathe fails temporarily, and nasal airflow and chest wall movement cease. Oxygen drops. And this is common in patients with brainstem injury, muscular dystrophy, and encephalitis. It's kind of crazy. What is narcolepsy? Dysfunction of mechanisms that regulate sleep and wake cycles. What do you think the most common complaint is associated with narcolepsy? excessive daytime sleepiness. So they fall asleep and then they reach a REM in like 15 minutes of falling asleep, which is crazy. What is a cataplexy? Like sudden muscle weakness during intense emotions such as anger, sadness, or laughter that occurs at any time during the day. And then what do you think sleep paralysis is? Feeling of being unable to move or talk just before waking or falling asleep. So cataplexy, excessive daytime sleepiness, and sleep paralysis are all kind of symptoms of narcolepsy. So how do you think we treat narcolepsy? Use like stimulants or wakefulness promoting agents such as sodium oxybate, modafinil, or armodafinil, something like that, to help with that. You also get antidepressant meds to suppress cataplexy and other REM related symptoms. Alright, so what do you think some of the physiological symptoms of sleep deprivation are? Ptosis, blurred vision, fine motor clumsiness, decreased reflexes, slowed response time, decreased reasoning and judgment, decreased auditory and visual alertness, and cardiac arrhythmias. What are the psychological symptoms of sleep deprivation? Confused and disoriented, increased sensitivity to pain, irritable, withdrawn, apathetic, agitated, hyperactive, decreased motivation, excessive sleepiness. So parasomnias are sleep problems most common in children or adults? Children. Alright. How many hours a day do neonates sleep? 16 hours. How many hours a day do infants usually sleep? Roughly 15 hours. How many hours do toddlers sleep? 12 hours a day. How many hours do preschoolers sleep? 12 hours. How many hours do school-age children sleep? 6 is like 11 to 12, and then when you're 11, it's like 9 to 10. How many hours do adolescents sleep? 7 hours or less. And how many hours do young adults sleep? Somewhere between 6 to 8.5 hours, things like that. Alright, reviewing things that we've gone over, alright? Remember, narcolepsy, it's like a dysfunction of mechanisms that regulate sleep and wake states. Most common complaint is excessive daytime sleepiness with narcolepsy. Basically with this, fall asleep during the day and reach REM in 15 minutes. Also have cataplexy. It's like sudden muscle weakness during intense emotions such as anger, sadness, or laughter that occurs at any time during the day. Then you could have sleep paralysis. It's like a feeling of being unable to move or talk just before waking or falling asleep. It's crazy. A person with narcolepsy falls asleep uncontrollably at inappropriate times. That's crazy. So what if you're driving? Jeez. Jesus. So, treat this bad boy with stimulants or wakefulness promoting agents such as sodium oxybate, other things like that. Get antidepressant meds for the cataplexy. Don't sleep longer than 20 minutes in the daytime. That'll help. Get exercise. Get good sleep habits. Eat light meals. Chew gum. Vitamins. Those things can help too. Physiological symptoms of sleep deprivation be like ptosis or blurred vision, fine motor clumsiness, decreased reflexes, slowed response time, decreased reasoning and judgment, decreased auditory and visual alertness, cardiac arrhythmias. Then you can have psychological symptoms like confused and disoriented, increased sensitivity to pain, irritable, withdrawn, apathetic, agitated, hyperactive, decreased motivation, excessive sleepiness. With parasomnia, these are most common in children. Neonates, they sleep for 16 hours. Infants, they get around 15. Toddlers, getting 12. Preschoolers, they're getting 12. School-age children, if they're like 6, they get like 11 to 12, but 11-year-olds get 9 to 10. Adolescents, 7 or less. Young adults, 6 to 8.5. All right, so I'll talk about drugs and their effects on sleep. What do hypnotics do during sleep? So they interfere with reaching deeper sleep stages. They provide only temporary or like a 1 week increase in quantity of sleep. They eventually cause hangover during day, excessive drowsiness, confusion, decreased energy, and they sometimes worsen sleep apnea in older adults. What do antidepressants and stimulants do during sleep? They suppress the REM sleep and they decrease total sleep time. What does alcohol do during sleep? It speeds up the onset of sleep, but it reduces the REM sleep, and it awakens persons during night and causes difficulty returning to sleep. What does caffeine do during sleep? Prevents person from falling asleep, it causes person to awaken during the night, and it interferes with the REM sleep. What do diuretics do during sleep? You get woken up during the night because you have to go to use the restroom. What do beta adrenergic blockers do during sleep? They cause nightmares, insomnia, and awakening from sleep. What do benzodiazepines do during sleep? They alter REM sleep, they increase the sleep time, and they increase daytime sleepiness. What does nicotine do during sleep? It decreases the total sleep time, it decreases the REM sleep time, causes awakening from sleep, and causes difficulty staying asleep. What do opiates do during sleep? It suppresses REM sleep and it causes increased daytime drowsiness. What do anticonvulsants do during sleep? Decreases REM sleep time and causes daytime drowsiness. What does the Epworth Sleepiness Scale evaluate? The severity of excessive daytime sleepiness. What does the Pittsburgh Sleep Quality Index assess? Sleep quality and patterns. So then we have some nursing assessment patterns, so like nature of the problem. So like what's going on when you sleep, what's the problem you're sleeping, are you getting enough sleep? Describe a recent night's sleep. How is it different from usual? Signs and symptoms, severity, predisposing factors, effect on patient, things like that. Then you got questions to ask for specific sleep disorders. So what are some questions you think you might ask for insomnia? How easily do you fall asleep? Do you fall asleep and have difficulty staying asleep? How many times do you wake up at night? What time do you wake up in the morning? What causes you to wake up early? What do you do to prepare for sleep? What do you do to improve your sleep? What do you think about as you try to fall asleep? How often do you have trouble sleeping? What are some questions to ask about sleep apnea? Do you snore loudly? Does anyone else in your family snore loudly? Has anyone else ever told you that you often stop breathing for short periods during sleep? Do you experience headaches after waking up? Do you have difficulty staying awake during the day? What are some questions we can ask pertaining to narcolepsy? Do you feel like falling asleep at the wrong times? Do you have episodes of losing muscle control or falling to the floor? Have you ever had the feeling of being unable to move or talk just before walking or falling asleep? Do you have vivid, lifelike dreams when going to sleep or awakening? What are some questions we can ask to determine a patient's sleep pattern? What time do you usually get in bed each night? How much time does it usually take to fall asleep? Do you do anything special to help you fall asleep? How many times do you wake up during the night and why? What time do you typically wake up in the morning? On average, how many hours do you sleep each night? All right, reviewing over these. So hypnotics, they're going to interfere with reaching deeper sleep stages, provide only temporary or 1 week increase in quantity of sleep, eventually cause hangover during days like excessive drowsiness, confusion, decreased energy, sometimes worsen sleep apnea in older adults. Antidepressants and stimulants, they're going to suppress Rem sleep and decrease the total sleep time. Alcohol speed the onset of sleep but reduce Rem sleep and awaken person during the night and cause them problems getting back to sleep. Caffeine prevent the person from falling asleep. They'll be woken up during the night and it interferes with REM sleep. Diuretics, you'll be woken up because you have to go to the bathroom. With beta adrenergic blockers, you get nightmares, insomnia, and when you're sleeping, you get woken up. Benzodiazepine, altering the REM sleep. You'll sleep longer, but you'll have more daytime sleepiness. Nicotine, you sleep less, have less REM sleep. You get woken up from sleep, and you can't stay asleep. Opiates, the REM sleep is suppressed, and you have increased daytime drowsiness. And anticonvulsants decrease REM, and you're going to have daytime drowsiness. So the Epworth Sleepiness Scale evaluates the severity of excessive daytime sleepiness, and the Pittsburgh Sleep Quality Index assesses quality and patterns. So some questions we can ask about the nature of the problem. Like, describe for me the type of sleep problem you're having. Why do you think you're not getting enough sleep? Describe a recent night's sleep. How is the sleep different from your usual sleep? Signs and symptoms. Do you have difficulty falling asleep, staying asleep, or waking up? Have you ever been told that you snore loudly? Do you have headaches when awakening? Onset and duration of signs and symptoms. When did you notice the problem? What do you do to relieve the symptoms? How long has this problem lasted? Looking at severity, how long does it take for you to fall asleep? How often during the week do you have trouble falling asleep? How many hours of sleep a night did you get this week? How does this compare to your usual amount of sleep? What do you do when you awaken during the night or too early in the morning? And the predisposing factors. What do you do just before you go to bed? Have you recently had any changes at work or at home? How is your mood? Have you noticed any changes in your mood recently? What meds or recreational drugs do you take on a regular basis? Are you taking any new prescription or over-the-counter meds? Do you eat any food like spicy, greasy food or drink substances like alcohol or caffeinated beverages affect your sleep? Do you have a physical illness that affects your sleep? Does anyone in your family have a history of sleep apnea, sleep problems? And an effect on patient. How has the loss of sleep affected you? Do you feel excessively sleepy or irritable or have trouble concentrating during waking hours? Do you have trouble staying awake? Have you fallen asleep at the wrong times? There's some questions to ask specific sleep disorders like insomnia, like how easily do you fall asleep? Do you fall asleep and have difficulty staying asleep? How many times do you wake up at night? What time do you wake up in the morning? What causes you to wake up early? What do you do to prepare for sleep? What do you do to try to improve your sleep? What do you think about as you try to fall asleep? How often have you had trouble falling asleep? Sleep apnea. Do you snore loudly? Does anyone in your family snore loudly? Has anyone else ever told you to stop breathing for short periods during sleep? Do you have any headaches after waking up? Do you have difficulty staying awake during the day? The narcolepsy? Do you fall asleep at the wrong times? Do you have episodes of losing muscle control or falling to the floor? Have you ever had the feeling of being unable to move or just talk just before waking or falling asleep? Do you have vivid, lifelike dreams when going to sleep or awakening? And then some questions we can ask to determine a patient's sleep pattern. Time do you go to bed each night? How much time does it take for you to fall asleep? Do you do anything special to help you go to sleep? How many times do you wake up during the night and why? What time do you typically wake up in the morning? And on average, how many hours of sleep do you sleep each night? So if they have physical symptoms interfering with sleep, you want to manage those. That's going to be our first priority. And then after they're relieved, you want to focus on sleep therapies. So promoting sleep for older adults. Sleep-wake pattern. Obviously, you want to have a schedule. Eliminate naps unless they're routine. If you do take naps, 20 minutes or less 2 times a day. Go to bed when they're asleep. Warm bath and relaxation techniques. If unable to sleep in 15 to 30 minutes, get out of bed. And avoid stimulating activities such as exercise or watching TV before bed. Environment, sleep where you sleep best. Keep noise to a minimum. Use soft music to mask it if necessary. Night light and keep path to bathroom free of obstacles. Set room temperature to preference. Use socks to promote warmth. Listen to relaxing movement. Increase exposure to bright light during the day. Use sedatives and hypnotics with caution as last resort. Only short term though. Diet, limit alcohol, caffeine, and nicotine in late afternoon and evening. Some carbs or milk as a light snack before bed. Decrease fluids 2 to 4 hours before sleep. Things like that. You can read this if you want patient teaching stuff. And this.